Good morning. That was very energizing music to get us going here this morning. On behalf of the Miller Center of Public Affairs at the University of Virginia, welcome to what continues, unfortunately, to be a timely topic that affects us all, the COVID crisis, past, present, and future. I'm John Bridgeland, a senior fellow at the Miller Center, co-founder and CEO of something called the COVID Collaborative, which is an initiative that has brought together top experts, leaders, and institutions in health, education, and the economy, and also representing the wonderful diversity of our country to help respond to COVID-19. We'll have a moderated discussion with two of these outstanding leaders today in the fight against COVID-19, and then open it up to your questions, which you can post at the bottom of your Zoom in the chat. I will try to get it to as many as I can. Now to our two extraordinary guests, and these are really two of my favorite people. Deval Patrick is the former two-term governor of Massachusetts. Under his leadership, Massachusetts ranked first in the nation in healthcare coverage, student achievement, and energy efficiency, and achieved a 25-year employment high. Really extraordinary work. A native of the South Side of Chicago, he's also a lawyer, business executive, entrepreneur, and investor. He served our nation as Assistant Attorney General for Civil Rights in President Clinton's administration and is co-chairman with Republican Governor Dirk Kempthorne from Idaho of the COVID Collaborative. We're also very privileged to be joined by Dr. Carlos Del Rio, who is Distinguished Professor of Medicine and Executive Associate Dean at the Emory School of Medicine, and a Professor of Global Health and Epidemiology at the Rollins School at Emory. He's the co-director and principal investigator of the Emory Center for AIDS Research and works on emerging infections, epidemics, and pandemics as a member of the WHO and CDC advisory teams. A native of Mexico, a member of the National Academy of Medicine, you see him regularly on TV talking about the COVID crisis, and is a member of the COVID Collaborative. Thank you both for being with us today.
Pleasure to be with you, John.
John, it's great to be with you, and thank you for your leadership.
Thank you so much. So Dr. Del Rio, let's start with you. You studied infectious diseases and pandemics across your entire career. What is COVID-19? Give us a sense of its toll on the US and the world compared to other pandemics. And perhaps most importantly, will it ever end?
Well, John, let's start by saying that up to now, we consider the mother of all pandemics, the 1918 flu pandemic, in which approximately 5 million people died around the world from influenza. We're already over that. So this pandemic may prove to be, and this pandemic is not yet over, so the COVID pandemic may prove to be one of the deadliest pandemics of humanity thus far. And it will prove also to be one of the most challenging and difficult to control viruses for a variety of reasons that we can go into. But the reality is that I think this has been a pandemic that has taught us a lot, but has also challenged a lot of our assumptions. And it has also humbled many of us. And I think a lot of what we need to learn from this pandemic is how do we prevent this from happening again? The reality is climate change and a variety of different issues is going to make this pandemic, this kind of infections, what we call zoonosis, infections that come from animals to humans, be more and more frequent. So this is the latest pandemic, but this is not the last pandemic. And I think the most important lesson going forward is how do we prevent this from happening again?
Very well stated. So Governor Patrick, over the weekend, we saw the devastating tornadoes rip through the Midwest, including Kentucky, and our prayers and yes, support to those families go out to all of them. And as a governor, you've dealt with emergencies frequently. Give us your perspective on how the country has responded to COVID-19 and specifically the role of governors in addressing it?
Well, John, I think in my experience in office, our emergencies, and there were several, tornadoes and blizzards and, a water main that broke that threatened to deprive all of Eastern Massachusetts of drinkable water for months, to say nothing of the marathon bombing. They were limited in time and place specific. I think in all of those examples, it was enormously important that we coordinated all of the resources that were available to us at different levels of government, and also public and private. And when I say private, I mean also citizens. How to engage them, not just inform them, but engage them in helping us recover. I think at the national level, what is true of an epidemic, of course, is that it doesn't recognize state lines. It has spread quickly across states. And at the beginning, governors were largely left to sort it out on their own. I know a lot of governors felt that way. And I think coming together through the COVID collaborative was one of the ways that we helped to fill that coordination void.
Very good. Yeah, the nation's governors have really been called upon. Of course, this gets very local, very fast in terms of the response. And trying to influence the decisions of 300 million Americans is a remarkable challenge. So, Dr. Del Rio, looking at let's diagnose the nation's response for a bit to inform the future as Omicron and potentially other variants come into the mix. What do you think we got right? What did we get wrong? And how can we learn these lessons from the past to better prepare us for the future?
Well, I think without doubt, what we got right is Operation Warp Speed. The way that science, government, industry, and community participants in clinical trials got together to get us to where we are in COVID vaccines was really unprecedented. And it was all put together because there was tremendous financing, money was put in by the government. When people ask me, well, were there any risks associated with the development of vaccines? The only risk was financial. The government said, let's start producing vaccines before we know the results of the clinical trials. And if the clinical trials are not successful, we'll throw them away. But if they're successful, we will have the vaccines at that point, and we don't need to wait for them to be manufactured. So I think Operation Warp Speed is a good example of what we could be doing and how we can be working together. As Governor Patrick says, I think one of the challenges that we have is that, is federal versus state. The federal government doesn't run public health. This is a public health emergency. It's up to the states to manage public health. And to me, this has been a little bit like, having a war. Let's suppose the US went to war and each state was in charge of their own army and getting their own rifles and getting their own supplies and training their own soldiers. We would not be successful as a nation in fighting that war. And therefore, we have not been successful as a nation in fighting this war. I continue to see, for example, states, outbidding each other to get nurses or to get certain things. We needed a national coordination. We needed an air traffic controller. We needed somebody to call us together from the very beginning. And I think, what we really have gotten wrong is how we made this pandemic partisan. And, this is not a Republican or Democratic pandemic. This is a pandemic that affects every American. We have crossed, 800,000 Americans dead. 1 in 450 Americans has died of COVID. This is an enormous tragedy. This is costing a lot to the economy. People have lost loved ones. People have lost jobs. The economy is suffering. And we somehow have not come together still now in an effective way in addressing this and combating this. And I think we've gone from disarray to frustration. And we need to really come together and decide how we're going to end this, because John, this will end. But when it ends, it's depending in large part on what we do to end it.
Yeah, very well said. John Honeycutt from the audience, just a follow-up to you, Dr. Del Rio, he criticized the WHO and asks, what is the U.S. doing to provide early warning, detection, and prevention of future pandemics going forward? Have we done enough there? And what would be your thoughts in response to John's good question?
Well, it's interesting that the CDC, the U.S. government through CDC and USAID has set up this influenza surveillance centers throughout the world. And, everybody knew that in Southeast Asia is where the pandemic of influenza will emerge. I don't think we've done a very good job of coordinating and working together with our Chinese colleagues. I mean, after SARS emerged, we should have had a much better coordination and collaboration with China, because now this is where the pandemic has emerged. And this is where, we have had a lot of difficulties from the very beginning in China, letting, US and foreign investigators go in. I think WHO has a significant problem. WHO, most healthcare systems, my healthcare system in the US has a higher budget than WHO. You can't pretend that WHO, with a minimal budget, is going to coordinate the global response. And I think one of the things that needs to come out of this is really a reform of WHO governance, of WHO ability to do things, but also of WHO financing. We cannot continue to have a weakened WHO and pretend that they're not responding appropriately, because they're not going to be able to respond appropriately. The US has typically played a major role in global health. I mean, I would say that one of the most successful programs ever implemented is PEPFAR. And I credit, our President George W. Bush for that. I mean, without his leadership, we would not be where we are in the HIV global response. But during the Trump administration, we became more local and global, and we gave up on globalization. And that void has been filled up by China, by Russia. And I think one of the things that needs to happen, and I still don't see the Biden administration as, taking that role of global public health leaders that we had in the past. And, I travel throughout Latin America. I talk to colleagues throughout the world, and the vaccines that are being given left and right are Chinese and Russian vaccines. And, again, the void is being filled by other global powers. So we, as a nation, need to also, part of ending this pandemic is becoming again a global health leader, and the U.S. has a role to play, and we're really not there yet.
So, Governor Patrick, it's interesting. One of the lessons learned that Dr. Del Rio mentioned was that, in times of national crisis, it usually brings Americans together in common purpose.
Mm-hmm.
And here we've had unexpectedly simple public health measures like masking and vaccines and various requirements at the local or state levels, causing tremendous partisan eruptions. So tell us, what is the COVID collaborative that you co-chair? Why was it formed, and what have been its more important contributions and lessons learned?
Well, John, just to your first point, I in my wildest dreams, I wouldn't have imagined that you could politicize a public health emergency. And that is what this has been. To the point earlier about coordination, that tone and the importance of coordination needed to be set at the top, and an opposite tone was set. And for that reason, the COVID collaborative was formed. Dirk Kempthorne, the former governor of Idaho, a Republican, and I, with your encouragement and indeed your leadership and others, decided that we ought to try to convene some of the best epidemiologists, public health experts, business leaders, civic advocates, organizations ranging from the U.S. Chamber of Commerce to the NAACP, and education leaders, and try to reach consensus on what the best strategies were in response to the best science on everything from masking and testing to ultimately to vaccines, reopening schools, and so forth, so that there was some common source of common wisdom about how should make decisions. When the new administration came on, as you know, many of the people who had participated in the collaborative went into the administration and have continued to build on some of that foundation. But again, I think the coordination role is enormously important, was a missed leadership opportunity for the outgoing president, frankly, was a missed political opportunity as well.
It's interesting how, with the platform for shared work, Americans came out of the woodwork to make common cause from
people want to help.
Yeah.
We still understand at some level that we have a stake in each other, that at some level we belong to each other. And
it's interesting, because I think that I think that happened at the beginning. I mean, I saw it in the hospitals, people cheering for healthcare workers, bringing food.
Right.
I think that happened at the beginning. We saw people helping each other, but I think somehow we didn't build on it. I mean, I think
Yes.
people did it initially, and then somehow it just didn't happen. And we didn't build on it. And I think we didn't build on it. I think one of the biggest sort of mistakes is we weren't able to communicate. At some point in time, we got into this fight of public health versus the economy. And I think somehow we were not able to communicate that it's not public health or the economy. Is having public health is critical for the economy's success.
Exactly.
And I think one of the things that I would say we did wrong in public health is, and I say this coming from HIV, we told people many times what not to do. Don't go out of your house. Don't do this. Don't do that. And, in the world of HIV, we learned a long time ago that telling people not to have sex doesn't work. You got to get people to know how to do it. We call that risk mitigation, So I think we should have been able much better. And, we didn't have enough data, so we weren't able to do it. But now we have the information. And this is where the way forward goes. We need to be able to tell people how to do things safely, as opposed to telling people, oh, you shouldn't get together for the holidays. We need to tell people how to get together for the holidays, how to do it in a safe way. And I think we need to better communicate with people this approach of, look, we're supporting you. We're trying to make it easier for you. But these are the things that are going to happen. And this is how the government and this is how the industry and other people are going to help you achieve it.
I want to build on that, Doctor, because I think it's an enormously important point. I will say that in the collaborative, one of the things we tried to do in that department of here's how to help you have the life you want, and that is access to rapid testing, lots and lots and lots of testing, and it was enormously difficult to move that forward. The capacity for it, I think, frankly, is still lagging. But that was part of how we thought about helping, is alongside the masking. Of course, we know more now than we did then, as you said, and so I think shifting to how we live our lives, given what we know, particularly given at least the early indications of the effectiveness of the existing vaccines with the newest against the newest variant, is probably where we need to move today.
Yeah, it's interesting with this $250 million vaccination education campaign with the Ad Council, as we learned over time about a more compassionate, welcoming message that gave people a little glimpse of what was across the horizon in terms of the hope. The good news, and it doesn't always get reported, is that across all these southern states that have had lower vaccination uptake rates, we're seeing gains that outpace the national average. With this sort of approach, Dr. Del Rio and Governor Patrick, that you've just outlined. William Dunn has a wonderful question, which is, what is another solution for bridging the partisan divide related to the COVID public health effort? Let's go right into the middle of the public health crisis, the undercutting of public health authorities at the state level. How can we bridge this partisan divide in a way, or the divide among Americans, to be more effective in our public health response? Dr. Del Rio, you want to take that first?
Well, the first thing I would love to see is every governor support, defend their public health. They have a director of public health in their state, but also each one of their public health employees in the state should be rewarded, should be treated appropriately, should be, quite frankly, paid appropriately. I think a lot of those are some of the lowest paying people in many states. I think the second thing, whether it's Republican or Democrat, every governor needs to see their public health person as important as any other person in their cabinet. I think the second thing is we need to have public health needs to be more engaged with the concerns of everybody. And we need to make it very clear that, this is not, I honestly think of, telling people, well, you're responsible for this crisis now because you're not vaccinated. And it happens that many of those people happen to be, Republicans or voted for Trump. It certainly doesn't help public health. And it also doesn't help the situation. I think, public health has always been political and will always be political. But public health should never be partisan. And I think the mistake we make is to make public health partisan. We need to be sure that we stay above partisan politics. And we really talk about how public health is helping you regardless of where you come from, who you are, or what your needs are. And that to me has to be, it's a messaging. It's really about getting people to understand how public health benefits everybody. And not, I'm not trying to tell you, I mean, I heard somebody say, well, nobody tells people in states, in case where there's, a very severe winter, nobody tells you you must wear a jacket because otherwise you're going to die of frostbite. Yeah. Well, it's a little bit like, we're not telling you must wear a mask, but we're telling you why it's important to wear a mask. We're trying to make you understand the benefits. And also, I think what has made it very hard is we haven't really been able to communicate an exit strategy for this whole problem. Mm. When I think about it, we're 2 years into this epidemic and we still don't have what I see an exit ramp, an exit strategy. And people are getting tired of that. People want to see how you plan to end this. And I think we have now enough information to be able to say, this is what we need to do to end.
So Governor Patrick Williams, Stefan from the audience asks a really good question that builds on an issue you raised in your last contribution, which is, would an Operation Warp Speed approach for testing and rapid testing be useful? What are your thoughts?
Well, I want to be careful not to step out ahead of the public health expert we have on this panel, but I remember early in the pandemic, my wife, who was a cancer survivor, and I were talking, and we were, sequestered away at home and had been with our family and very, very careful. And I said to her, how would you feel if we went out to dinner in a restaurant where everyone else had tested negative before going into the restaurant? She said, I'd feel perfectly fine. And, it's the N in that study is very small, but I do think there is value in having high integrity, rapid tests available for lots and lots of settings. You go to many meetings in New York now. You can't go into the meeting without showing your vaccine card and also having on premises a rapid test. So I think there's a lot to like about that. I would defer to Dr. Del Rios. I think there's a lot to like about that. I just also add to what Dr. Del Rios was just saying, this idea of what our exit strategy is, what it will take to, if not beat the virus, then learn to live with it. What are the normalized strategies that keep us safe, and continuing to invest in the refinement of the vaccine, so that they are responsive to new variants, just as we do with the flu vaccine, and I believe with others, will be enormously important going forward.
I think, John, one of the things that needs to happen is, for example, at the FDA level, rapid tests are still regulated as medical devices. They're not regulated as public health devices. We need reform within the FDA to really allow you to regulate certain things like rapid tests as public health devices. The other thing is we need to make sure that those rapid tests are readily available. I agree totally with the governor. I mean, before there were vaccines, and even now with vaccines, but before vaccines, I would travel to visit my children in New York or Miami, and I would do it by testing myself, 72 hours, 48 hours before the flight, arriving there, testing myself 48 hours after the flight. I mean, I think testing can be incorporated to really ensure that when you go visit somebody who's unvaccinated, you're not going to be transmitting the virus and you're going to be negative. But the reality is the rapid tests currently available in our country are prohibitively expensive for the average individual. And, we need to make them readily available. And I'm still very surprised. I mean, I commend the Biden administration saying, we're going to make rapid tests available to everybody. I'm yet to see them doing this, because they said, well, you're going to have to submit it to your insurance company is going to have to pay for it. I mean, they should have just thrown a ton of money, subsidized it, and say, every individual has access to 3 rapid tests a month or 4 rapid tests a month or whatever. But,
Yep.
I see so many parents that a kid, they call from the school saying one of the kids in the class tested positive and everybody's sent home. I mean, it's a moment of anxiety. Everybody's anxious about it. Let's go ahead and just have a test at home, test everybody, be done, move on, right? So I really think that we have missed having testing as a really important component of feeling safe. And what people want is to feel safe. What people hate is uncertainty. And not knowing where you stand creates uncertainty. And that uncertainty creates a lot of anxiety. And that anxiety creates a lot of anger. And at the end of the day, then you have people not willing to listen to public health because we're not helping them.
I think William Dunn is right. It's so empowering of Americans to have a free or very low cost rapid test. I'll just say the COVID Collaborative, as Deval and you know, has been pushing really hard. You go to France or Italy, these other countries, the tests are free, they're accessible. People can restore some hope and confidence in living their lives. So I think it's a really good idea, and I want to thank William Dunn for offering it. So Dr. Del Rio, Omicron, which sounds like a creature from a Transformers movie. I almost reach out to my friend Lorenzo de Bonaventura, who produced Transformers, to tell him it should be a new evil character in the movies. But it's fast occurring across the country. What do we know about it? How can Americans protect themselves against it? And do you see more variants emerging down the road?
Well, this virus, John, has proven to be mutates a lot. It's one of those RNA respiratory viruses that when it reproduces, it mutates. When you have a lot of transmission, you're going to have a lot of reproduction, you're going to have a lot of transmission. I think we're seeing these variants emerge in places that have very low vaccination rate, whether it's India with Delta, Brazil with Gamma, South Africa with Omicron. And so one of the things that it's telling us is we have to stop transmission locally, but also globally. And as long as we don't do it globally, we're going to continue to see variants emerge in areas of the country that have low vaccination rates, because that's where transmission is occurring among unvaccinated individuals. We know several things, and the science is still advancing. We know that the strain is very, very contagious. It's highly contagious, and it's rapidly spreading. We also know that vaccines don't work as effectively as they did against Delta or Alpha. But we also know that giving a booster increases the efficacy of those vaccines against this strain. Does it cause more severe disease or not is still debatable. I think some data suggests it may not cause as severe disease. But I caution people saying, if this strain is 10 times more transmissible and you therefore have 10 times more infected individuals, even if it's 10 times less serious, you will still have a lot of sick people just because the sheer numbers there. So doing the math, I'm still very concerned about. So at the end of the day, I think we need to be careful about protecting our most vulnerable populations. I think, if young people get infected and nothing happens and they have a cold for a couple of days, I think it's okay. But I still, I want to see Omicron. I'll go through a nursing home before I tell you, oh, this is nothing. Because the reality is it may be very serious when we're talking about older individuals. You got to remember that, among Americans 65 and older, nearly 1 in 40 has died of COVID. So again, older individuals, the biggest risk factor for having severe disease and dying of COVID is advanced age. And I think we need to do a good job, going forward to protect our older population. So we need to make it a priority to boost everybody over the age of 60 for sure.
Yeah, I was looking at the numbers this morning, just remarkable. We're approaching 800,000 deaths in the United States, which is 200,000 more than the Civil War. It's a staggering loss. And Governor Patrick.
John, if I may,
Yeah.
I'm sorry to interrupt you, but
Please.
This has been a tragedy, and it has completely disrupted so many lives. I was talking to somebody last night who made the comment I'm sure we've all heard or said, which is that we've lost all track of time in the last 2 years. I think one way in which to honor those we've lost is to learn from their sacrifice and to build on what Dr. Del Rios was saying, to shift the way we go forward to how it is we have contact with people, loved ones, go to work, go to school, and so on, with the kinds of tools we know we have available. And so universal access for free or nearly free, the vaccines and the boosters for them. And when I say universal access, I mean not having to go to some site. Have them close by where it's easy for people to get testing that is free or nearly so for everybody, everywhere, so that we can get on with our lives and do what we can responsibly to protect ourselves, our families, and each other.
so smart. And, one of the follow-up questions was there's the variability across states in the availability of testing, also, in rural areas. So couldn't agree more. The country needs a national testing policy in response. But let me go back to this, this staggering loss. Governor Patrick, last week, you launched a major report called Hidden Pain about the 167,000 children who lost a parent or other in-home caregiver to COVID-19. Tell us about that and some of the ideas you have for what the nation can do about it.
Well, first of all, I think it's important to acknowledge the special vulnerability of the loss of these children. They are children, and they have lost parents and/or caregivers, and they are more vulnerable as a result. Some of them are cast into poverty, or their own existing poverty has deepened, and the uncertainty around that. They are grieving. They're trying to manage school and food and the rest of it without a central parental figure. And the resources, in many cases, Bridge, as you know, exist. Not in every case, but school counselors or philanthropic resources and so forth, or public programs. But they're not very well coordinated. Again, this point, we have not focused on identifying those individual children, identifying what their particular needs are at age level and personally, and really delivering those needs and assuring that we are delivering those needs so that we don't have the lasting human toll of this tragedy. And so what we were asking in that report is that the White House call us together, really show leadership on this point for this population of grieving children, and meet their needs. And there's no doubt in my mind that the president's own deep empathy responds to this need. There's also no doubt in my mind that the White House may be, and the president may be, the best positioned to call us public and private resources and private people to focus on these needs and bring some real coordination to bear.
And I would add to that. That I first of all want to encourage everybody to read this report. It really is a very important report, and I do think that one of the lasting consequences and one of the most difficult things to deal with this pandemic going forward is not necessarily long COVID. Long COVID is going to be a problem, but it's going to be actually, the number of children who have lost caregivers and parents, and number two is going to be the mental health consequences. And I really think I want to emphasize that the issue of the orphans from COVID is particularly severe for minority populations. And again, this is going to make it even harder for those kids. They're going to be left behind. They're going to be left behind even more than they already are. So, I see ourselves going into a country of greater disparities if we don't address this issue. So it really has to be a social equity issue. I would not call it a health equity, but really a social equity issue. If we don't address this, we really have a major problem going forward.
I was so thrilled to see the NAACP and Unidos US and the National Congress of American Indians and the Asian Pacific Islander American Health Forum all come together around this powerful wedge of recovery and renewal for those children whose whole sky has fallen with the death in the last 22 months of so many Americans. So thank you, Governor Patrick and Dr. Del Rio, for what you're doing on that front. So Dr. Del Rio, you've dedicated your career in public health, and Rose from the audience says, how do we engage future students to consider public health as a career path and train them to engage with technology in this realm to help control a future pandemic? And I might add, especially in light of the strain and tensions and difficulties that our healthcare workers have faced. Could you reflect on that?
Well, yes. I mean, I think that, number one, I really think that the Association of Schools of Public Health and School of Public Health throughout our country need to come together and really think about how do we use this to really engage more people to come into public health, and how do we train them appropriately going forward. I think, several things that we need to do in schools of public health are, for example, train our students about policy and about politics, and how to deal with social media, and how to deal with misinformation, and how to communicate to people that don't agree with you, and how do you get the message across. I think it's a time to teach, compassion. It's a time to treat caring and understanding. I think the other thing we need to do is really need to put our values ahead of our profits, right? And as a country, I think we're a country of values, and I would wish that we would stop paying an enormous amount of money to people who are working in finance and investing money and moving money around, and paying appropriately to people who are working in public health and who are really in the front lines. And not only the public health workers, but I think about our first respondents who really are in the front lines, and many of them are volunteers or make very little money, but they do it because they want to. I think we need to compensate people appropriately in those jobs. And then the last thing, we need to create a career path for them. Many of those people, are stuck in careers that don't have a career path forward, and we need to allow them to do that. I do think bringing business and technology at working closer with public health is going to be critically important. Today, a lot of public health, a lot of health is being taken up by companies like Google and others. How do we get public health to work with them? How do we get public health to really collaborate with the Googles and YouTubes and others of the world to really create the future of public health in our country? So there's a lot of opportunities, and there's a lot of ways, and I think we can make public health incredibly exciting to people interested in technology, interested in advancing future interventions, and really addressing health disparities. Again, what this pandemic has shown us is that health disparities is something that we can no longer ignore in our country. And there are many people committed to ending health disparities. We got to make sure that we give them the resources in order to do that.
You're so wonderfully passionate about health and your work, Dr. Del Rio. One answer is to deploy you to colleges and universities across the country.
Amen.
Make the case to the next generation. So Governor Patrick, Ronald Stokes focuses in on something that Dr. Del Rio touched on, which is, how do we combat deliberate misinformation in the COVID-19 space? Obviously, also in the protecting our democracy space, a whole host of other issues. And then talk a little bit about, there's a tension in our values and our national life around COVID-19. Americans value their freedom, and yet, there are clear evidence-based interventions that masking, vaccines, other things that restrict that freedom. How do we navigate all of that? And then how do we combat misinformation and get reliable information to people who are so desperately needing it?
Two hard questions in a row. On the disinformation. First of all, in a completely different project, I co-chair something called the Future of Tech Commission, which is also bipartisan, independent of the administration, but formed in response to White House and FCC interest in developing a framework around technology for the administration. And one of the things we're asked to look at is the issue of disinformation and platform safety. We'll be coming out with some recommendations on that soon, but it's remarkably easy to spread mis and disinformation around to all sorts of communities, and very, very difficult given, frankly, some of the business models or business choices that companies have made. Very, very difficult to respond to it and to call it back. So we've been working on this. It's not easy, but I think we have some ways forward. I will say, in the meantime, and no matter what our recommendations are, there are ways in which we forget the importance of engaging at the community level and at the grassroots level. Politically, I'm very interested in how we build a permanent grassroots infrastructure of people who are building engagement and frankly, networks of trusted relationships. Because frequently, when you hear something outrageous, you turn to somebody You ask them, have you heard that? What do you think? It's a very natural thing. And we need networks of trusted relationships in order to be able, I think, to get out credible information that helps people respond. On the question of freedom, I have to tell you, this is a remarkable nation because we are formed unlike other nations, not by geography or religion or even a common language. We're formed because of a handful of civic ideals, and this idea of liberty is dependent on opportunity, equality, fair play. It is why when we show real fealty to that, we have been a model and a magnet for the world. So I see the notion of freedom as centrally patriotic, as central to our patriotic notions. But so is the notion of protecting your community, your responsibility to community. And so I think rather than dismiss those who are claiming freedom as their reason for not complying, if that's the right word, or resisting some of the public health advisories about how to keep us safe, I think it's to meet them where they are, and frankly, where I think we all ought to be, that freedom is not kind of rampant self-centeredness. Freedom is dependent on a free community, a free city or state, and a free nation. And that requires and expects and demands some responsibility of us toward each other. I will support what Dr. Del Rios was saying, that the messaging, if that's the right term, on how we respond might have been from the beginning, and certainly ought to be now, how we adapt to what we have so that we can be together with each other, rather than how we hunker down and hide from each other. And I think we know enough now to be able to start to move in that direction.
I think I would add to that, John, that I think I totally agree with Governor Patrick. But the other thing I would add is that certain words we know are highly inflammatory to the population. Mandate, for example, is highly inflammatory. Change that to requirements, right? There's ways to say a requirement to work here. For example, a requirement for me to work in healthcare is that I have a hepatitis B vaccine, that I have, be drug tested now, I get an influenza vaccine. It's a requirement. It's not a mandate, but it's simply a requirement for me to work here. Should I choose not to work here, I don't do those things. But I think, talking about requirements makes it a lot more, people tend to understand it a lot better. So I think we also need to figure out, it's a lot about messaging. I do think this misinformation issue is really important. I think there are three things that I would add to what was said. Number one, it's about leadership. I think we need leaders to be out there at all levels saying, this concept, this thing that is out there is wrong. This is a lie. This is not true, and repeat it over and over. Number two, I heard about an interesting program the other day in which kids in schools were being taught how to distinguish misinformation. How do you learn about the web, and how do you check your sources, and how do you go about? So I think we need to make people more capable of really being able to find right information, and what are the tools that you need in order to be able to distinguish true from false in the internet, where there's a lot of false stuff. And then the third thing is when we identify bulls or other places that are rapidly disseminating misinformation or frankly, false information we should treat them as national security issues. And I'm talking about all sorts of potentially dangerous information that is affecting our ability to respond to something. And as such, we should block them. There's got to be ways to really treat many of those sources of frankly dangerous information as national security threats, because at some point in time, they're putting the population at risk, they're putting our nation at risk. And I think not only about COVID, I'm thinking about threats to our democracy.
You both articulated very tough questions so beautifully. We are at the University of Virginia, so it's worth reflecting that Thomas Jefferson, when he wrote that mystical notion of the pursuit of happiness, wasn't just talking about an individual right. but a cooperative enterprise we help one another achieve. And so when individual Americans are making decisions about whether to wear that mask or to get a vaccine, it's not just their right, it's also affecting, we ought to be thinking of our neighbors and our communities. So that was very compelling. One thing that the audience is very interested in finding the hidden pain report, you can go to covidcollaborative.us, and it's actually in the featured section. It's the first featured piece, and you can download the report. You can see the New York Times article in which Governor Patrick is repeatedly quoted, and other news that's emerged from it. But we're really trying to create prompt action out of that report. It's not just an academic exercise, but a one where we hope the country will respond. Governor Patrick.
You know what, Bridge? I would just add that if those who read the report have feedback, ideas that build on these, or that are fresh and helpful, we'd love to hear them as well, because our own thinking and advocacy continues to develop.
Yeah, exactly. And to Dr. Del Ria's point, we're training a generation of young people in coding, but we also need to train them in decoding information. What's the sources of information? Is it valid and true? I think that was a really powerful point. So folks have raised this question about sort of an exit strategy, or, what's next. And the Miller Center Public Affairs has been a leader in creating these various commissions. The Federal Election Reform Commission, Phil Zelikow led the 9/11 Commission, and we actually brought Phil Zelikow into the COVID Collaborative to look at the creation of a COVID commission that could learn from the past and plot the future. I wanted to ask both our guests, as we prepare for the future of COVID-19, of future pandemics, what do you think of an independent commission to get going soon that would actually study the problem and provide recommendations as we move from Delta to Omicron to the next variant? Dr. Del Rio?
I think it's been very important to have not only an independent commission, but a bipartisan commission. I really think, and again, the model of the COVID Collaborative of being bipartisan is critically important, because if we're not, it's just going to be seen like this is something that was proposed by the Democratic administration, and therefore this is going to create mistrust. We really need to bring different players into this picture, and we really need to find common ground in how to be able to prevent this from happening again. I think this, if you give us as a nation a grade for the way we responded to this pandemic, I think we get a C. We have not done a good job, and I think learning from the mistakes, learning how to prevent this going forward is going to be really important, and applying it and really implementing it. We did this in 9/11. We have done it in other situations. I'm sure we can do it again.
Governor Patrick, any thoughts?
I would call it a nonpartisan rather than bipartisan, meaning, yes, there should be representatives from both parties, but they shouldn't be representing their parties, and right. They should come to it as responsible citizens. And I hope, as it was true in the 9/11 Commission, they came with deep sense of inquiry in that and earnestness, but they weren't looking to score points. They were really humble, and they listened to the answers, and they compared answers, and they drove through to some common truths. And I think that's what we're going to need here. There are some lessons about how to earn an A the next time we have a pandemic in this country, and we should be paying attention to them, because there will be another time.
And engaging in just the good comments from the participants in this panel today, generating good ideas. We should listen to the American people more and their experiences and what would have helped them come to better, a more hopeful response. We've talked a lot today about the impact of this pandemic on the United States, but it is a global pandemic, and the COVID Collaborative has an effort with Duke and other institutions around the country to help close for example, the COVID vaccine gap in developing countries. Dr. Del Rio, is there anything we can learn? We heard about New Zealand early on and some of these other countries that seem to be having a better plan in place. Anything valuable we can learn from other countries about responding to the pandemic here in the United States?
Well, it's interesting, John. I talked to colleagues, for example, in Portugal, and I said, why does Portugal have such a high vaccination rate? And they said, we never made it political. We made the vaccine as like we do any other vaccine. And it was really never was talked about it as a political issue, as a partisan issue. So I think there's a couple of things we can learn from other countries about how to respond. But I do think that one of the most critical things we can do going forward is really to think about how can we ensure that our nation continues to have the leadership role in global health that it had. I mean, I really think it's critically important that we assume a role in which, it's not just a matter of giving. So far, what I'm seeing is we're giving vaccines almost like charity, right? Here's some vaccines to this country. There's not a strategy. And in many countries I hear complaints about the vaccines that get here are about to expire, then we don't have enough personnel to get into the arms of people. When we put together PEPFAR many years ago, it was not just about getting antiretrovirals to people. It was just, to countries. It was just getting pills into people. It was treating people. It was really creating the infrastructure that allows us to do that. And I think we need to really think about what infrastructure is necessary in order to vaccinate the millions of people that need to be vaccinated. And this, again, requires global leadership and requires, a summit. As of now, I'm surprised that, for example, we have a HIV coordinator at the State Department, and now Dr. Kennesaw is going to be appointed to that role by the administration. We still don't have a similar role for somebody around COVID, somebody who's really addressing a pandemic and this very moment could really talk about the different agencies. How do we get State Department, Defense Department, all the different departments to work together? And I think that's one of the things that I think could be done fairly quickly and can really be implemented in a highly effective way.
It's so powerful. Governor Patrick, it makes me think about our early efforts to bring governors together, right? Particularly when there wasn't a national plan, governors were on the front lines. Any thoughts about, as we look to the future, what can we do to strengthen state and regional cooperation or bring governors together or mayors together, at least to learn from one another, if not cooperate and coordinate with one another, given, as you said early on, this crosses state lines?
The National Governors Association once served that role for governors. I think it can. Again, there are similar roles for state and for municipal and other local leaders. They should be enlisted. There are trusted and credible voices in each of those organizations, past and present, who can be conveners as well. I completely agree with Dr. Del Rio about the importance of a summit, and one where there are not cameras, so there's not encouragement for elected officials to act out and do the performance art part of it. And frankly, I would include among the folks who are present, regular citizens who I think still are able to check elected officials when they act out and they aren't actually trying to solve a problem. I completely agree with the importance of having a global strategy, not just making resources available, but actually a plan to expand the vaccine. I remember I was at Coca-Cola at the time of the HIV strategy, and business was made a part of it. And we had one of the best distribution systems on the continent of Africa, and we put it at the service of the effort to get antiretroviral drugs out into to community. There's lots of creativity. People want to help. There is still, I think, compassion and empathy in Americans. But we're going to need leadership at all levels who call for that and model that so that it becomes more of a routine.
So, as beautifully said, another question from the audience, Alan Wyman says, is part of the problem here that we have a private for-profit healthcare system based on treatment and not prevention in the United States? Dr. Del Rio, you want to take that big one on?
Well, yeah, it's part of the problem. I would take that one on also by saying that healthcare has really been severely impacted. And And we're losing a lot of healthcare workers who are tired, who are exhausted. We're having a major crisis in our country with nursing that I think is going to take a while to resolve. But when you think about healthcare systems being stretched and suffering, I can also show you a report saying that some healthcare systems in our country they made the best profits ever, have made more money than they've ever had. This is just not compatible, right? In the middle of a pandemic, it should not be the time that you make your biggest profits. And when we need to see why that happened and why the inequalities were exacerbated. I do think that our healthcare system is very broken. And I think that we have dissociated. We have never put an emphasis on prevention. Again, I go back to what Governor Patrick Deval said. We were able to get vaccines to everybody and do it for free. Why can't we do that with testing?
Yeah.
Well, because it's we just don't know how to do it. I mean, the president said it was too hard to figure out how to do it. No, it's not that hard. Give the money, do it. Just do it, right? Like you did it with vaccines. Hard things are hard, but at the end of the day, yes, if we can use this to also reform our healthcare system, it'll be really very, very important. And I think will be, one of the most important achievements coming out of this pandemic would be indeed our healthcare reform.
Governor Patrick, you grew up on the south side of Chicago in poverty. You have had an extraordinary career in, all those sectors I mentioned when I introduced you. But you've had a glowing impact as governor of Massachusetts and in your public service at the U.S. Department of Justice, and sort of are a model leader for the country of, to give them hope and faith in our system. There have been a parade of questions in the chat. How do we restore faith in our government, in our public service, in a way that brings energy, given pandemic response itself is heavily governmental in resources and people and advice, the guidance it's given. Thoughts on that? That's another. I keep giving you the tough questions, Governor.
You really, you really do, and there isn't time enough for because I'm still trying to work out the answer to that question in my own mind and heart. You referred to my growing up on the south side of Chicago. When I was growing up, every child was under the jurisdiction of every single adult on the block. So if you messed up down the street in front of Ms. Jones, she'd go upside your head as if you were hers, and then she'd call home, so you got it 2 times. And I think what those adults were trying to get across to us was that membership in a community is understanding you have a stake in your neighbor's dreams and struggles as well as your own, that we belong to each other at some level. And that's the sort of leadership I crave as a citizen. No one I meet is looking for government to solve every problem in everybody's life. Nobody. But what we believe, I think, is that government has a role to play in helping us help ourselves. And that helping ourselves and helping each other is essentially what community means. Now, I think one strategy to get to that, if I may, is national service. You know how strongly I feel about this, how much I wish we all had, either military or civilian opportunities to be out of our comfort zone and alongside other Americans who come from different regions or different ways of thinking. Because we need to push through past the sort of cartoon image we have of each other, what we think we know about other people who are different from us, from the media or from social media or something, just to find out that in fact, we all bleed the same way. We all worry about the same things. We all want hope for a better future for ourselves and our families.
Beautiful. I think of, we just lost Colin Powell. And when you hear his story in Harlem and Brooklyn growing up, he talked about the same image of a community that really cared about him as a child and a young man. And he became what he became in part because of that spirit of community.
You bet.
So on that wonderful note, on behalf of the Miller Center of Public Affairs, I'd like to thank all of you for joining today. Your wonderful questions in the chat. I think we got to almost all of them. 2 of my favorite people are 2 distinguished panelists, Dr. Carlos Del Rio and Governor Deval Patrick, both really active members of this COVID collaborative. And also the Miller Center CEO, Bill Antholis, who's providing such extraordinary leadership to the Miller Center with all of its engaging events, and Professor Cristina Lopez Guattardi Chow for her dynamic leadership with this programming. And encourage you all to stay active in your leadership and your roles to make for a better country. And toward that end, everyone, please have a very, very safe and very happy holiday. And thanks again to our two guests. We are adjourned.
Thank you.
Thank you.
Thank you. Take care.